Tonight, the I-Team is exposing the mystery behind military deaths. This is a story you have not heard about. A local Army family tipped off the I-Team about troops who survived combat in Iraq and Afghanistan, only to die here at home in their sleep. Their families blame military doctors and commonly prescribed medication. Our I-Team investigation begins in West Virginia with parents crusading for their fallen hero. In Charleston, West Virginia, the wars in Iraq and Afghanistan have created heartbreak and anger for Stan and Shirley White.
There's still a lot of raw emotion there.
First, their son Bob, a Fort Bragg paratrooper, was killed in Afghanistan.
But there's nothing like the pain of losing a child.
Then, son Andrew survived his deployment to Iraq with Camp Lejeune Marines, only to die in his bedroom.
And so then it was like a double whammy. It's all over again, but twice the pain.
Stan and Shirley have kept Andrew's bedroom as it was the day he died as a memorial to him.
An impressive young man.
He did a lot of things in 23 years.
His Eagle Scout certificate, an award from the Junior ROTC, his Marine medals, pictures of his time in Iraq. But these walls do not tell the story of Andrew's psychological trauma from 9 months in Iraq.
He died because of his PTSD, caused by the war zone, because of the medication. Medication's what killed him. We consider him as being a casualty of war.
The medical examiner ruled Andrew died at the age of 23 from fatal drug intoxication. He was also taking non-prescribed medication at the time, and the report says it could have been a factor in his death. The Whites believe Andrew died from over-medication under the care of government and private doctors.
We call it the lethal cocktail. It's the antidepressants, the antipsychotics, and the analgesics.
Medications.
The Whites say Andrew was taking Seroquel, Klonopin, and Paxil. They still have the pills prescribed by VA doctors to treat Andrew's PTSD. Was there any chance he was over-medicating himself?
No. He was taking exactly what the VA told him to take.
You were giving him the medication every day.
I was giving him the medication. He made that choice to trust the VA. And that trust cost him his life.
Andrew White is not alone. He's one of the Charleston Four war veterans, all getting treated for PTSD, all taking similar medication. All died in their sleep within weeks of each other in this part of West Virginia. After hearing about the Charleston Four, a San Diego neurologist began investigating. With veteran advocates, he created this list of 300 military deaths linked to sudden cardiac arrest he compiled from news reports. He did not have access to medical files.
It came to the conclusion that these were somehow unique, unusual deaths. Young men in their 20s don't die in their sleep.
Dr. Fred Baughman also says the type and quantity of drugs can lead to a deadly outcome.
Specifically, it points to the antipsychotics and the antidepressants that they're on, which are known to cause sudden cardiac death.
Look at all the drugs they had him on. Xanax, Percocet, Klonopin, Celexa, Lunesta, Ambien.
John and Mary Nahas are North Carolina parents who came close to losing their son Michael after he returned from Iraq.
And I ran that list of medications by my niece, who was a psychologist in a psychiatric hospital. And she said, "Oh, Mary, that's a cocktail of death. They're trying to kill him." When the Army returned our son to us, he looked like a concentration camp victim. He was thin, he was gray in color.
They say medication prescribed for PTSD made Michael attempt suicide.
He was so confused. He jabbed in his arms 2 IVs and bled out completely in the bathtub and was drawing in his blood on the wall.
The I-Team obtained a copy of this Defense Department memo sent in February to all branches of the military. It specifically cautions medical providers about the use of some antipsychotics for anxiety disorders, including PTSD or sleep disturbances, especially given the risk of cardiac effects. And it says providers should offer the lowest risk medication and non-medication options. This is Andrew right here on the cover of Newsweek.
That's Andrew. That's Andrew.
In West Virginia, for Stan and Shirley White, the Defense Department recommendation on prescription drugs comes too late.
We still have the anger, we still have the disappointment that our government could do this.
Now, they're on a crusade.
It's an epidemic and has to stop.
The retired teachers have been to Washington 4 times, talking to members of Congress, the VA, the FDA.
I want to see a congressional investigation into why these kids are being over-medicated.
There's a destructive culture.
Both sets of parents want to prevent other military families from experiencing the pain they've endured.
And I can't honor them by not stopping this. And we've got 2 flags out there that say honor and remember. And I remember them, but I have to honor them also.
The VA investigated Andrew's death and ruled his doctors met, quote, the community standards of care, meaning the government believes those doctors did nothing wrong. The Whites want government doctors to scale back on medication and find other therapies like counseling and outdoor activities to help combat PTSD. The I-Team contacted the Army Surgeon General, who told us her office is working toward doing just that, as well as better communication between soldiers and their families, the commanders, and healthcare providers.